Professor Olivier Gléhen, nice to see you. Can you say to us why do you imagine to make this inter-university diploma regarding peritoneal carcinomatosis?
I think that now, regarding the place of cytoreductive surgery and intraperitoneal chemotherapy in the management of peritoneal surface malignancy, because we have now curative treatment, we evaluated preventive treatment. I think that it is very important to learn, to teach to general surgeons, to all surgeons, to radiologists, to gynecologists, new rules, new management in the general formation of our surgeon. How? Maybe with a theoretical course, because they have to improve their knowledge about etiologies, indication, perioperative management, and also practice by the mean of some stage into expert centers that are in France now well defined. To learn how to perform peritonectomy procedure, how to manage cytoreductive surgery, and of course, how to use intraperitoneal chemotherapy, and especially HIPEC. In Europe, for the moment, we have some course, especially in Hamburg, with the European Surgical Society Oncology Group, but I think that regarding the place of France in the treatment of peritoneal surface malignancy, we should have our formation and try to improve the knowledge of our colleagues in this field.
So, at the first times, two universities together, Lyon and Paris, and theoretical knowledge with practical place during 1 month in specific center with big activity and important knowledge about that, yes?
Yeah. We will have 90 hours of theoretical course for 2 weeks per year, over 2 years, because the formation will be delivered during 2 years. 1 week in Lyon, 1 week in Paris for each year, and we will try during this theoretical course learn about, as I said, indication, etiology, mechanism of dissemination of peritoneal disease, perioperative management, and of course intraperitoneal chemotherapy. And after that, we have well identified in France some expert or competence centers that are Institut Gustave Roussy with Dominique Elias and Diane Goerre, which is Hôpital Lariboisière with Marc Pocard, which is Lyon with me, which is Centre Val d'Orel in Montpellier with François Quenet, for the principal. It's very important for each participant to identify, I think, 1 mentor or 2 mentors to try to learn as we learn the surgery by shoulder against shoulder, as Paul Sugarbaker said.
So this is for the France, the organization that we imagine for the France, and maybe sometimes an ESO validation for that diploma, yeah?
Yeah. We are very close from the ESO organization, and this diploma will take part in the ESO certification, because as we start, the ESO start also to deliver certification on competence in the management of peritoneal surface malignancy. So now, Marc, We have also the project to improve the quality of our teaching by e-learning. So what is exactly the e-learning?
E-learning, the idea is that we want to share to the rest of the world community the ideas, the principles, the management of peritoneal carcinomatosis. And because of human history, as usual, I meet Argentine surgeons and we have friendship, and we discuss with the different university programs, and we are planning to make e-learning programs with help of Argentine people from Buenos Aires, from the Italian hospitals. And normally, if you hear me, or if you see me, it means that you are make the course of e-learning with Italian hospitals. And I hope that this e-learning gives the opportunity for the surgeon, but as you say, for radiologists, medical oncologists, for South America, to have the opportunity to access to this knowledge regarding all the things that you need to know for peritoneal carcinomatosis. And we make the same thing as for the French people, theoretical with e-learning, and we hope that you have place to make a short times with an expert centers regarding treatment of peritoneal carcinomatosis. There are some expert centers now in Argentina. They are coming progressively, but in the rest of South America too. And there is possibility to come in Europe and pass 1 month in Lyon. Are you agree with that?
Yeah, of course. Yeah.
So 1 month in Lyon if you want, 1 month in Paris if you want, or maybe in Spain, because in Spain we have a lot of friends.
Yeah, we have the Jacob Group that is in part directed by Santiago Gonzalez Moreno, which is really involved in teaching peritoneal surface malignancy management, and with with Marcello Geraco is taking in charge the ESO certification.
Okay, so you have the opportunity to teach with the e-learnings and to find a place to make your clinical practice. Is that correct?
That's correct. Thank you to all.
Thank you.